Many of us are hitting the beach to soak up the sun's rays, but as we know, excessive sun exposure can pose serious health risks.
Our Cindy Hsu spoke with Dr. Malika to get some advice on how to enjoy the sun safely.
Welcome, doctor. First, how popular is sunbathing? Is it less so now that we know how dangerous it can be?
Well, according to a survey by the American Academy of Dermatology, the number of adults reporting both tanning and burning rose from 2020 to 2021. Around 20% of respondents believed that getting a base tan could prevent sunburns and skin cancer, that tanning is safe as long as you don't burn, and 13% believed that tanning is healthy. Now, of course, none of these is true. Other myths are that you can't burn on a cloudy day, or you can't burn through a car window, or people with darker skin can't burn. None of that is true, and people still seem to be going out and sunbathing.
Wow. Well, let's talk about some of the health risks associated with excessive sun exposure.
So think of a tan as your body's response to skin damage, and a buildup of this damage over time actually leads to premature skin aging and wrinkling and age spots and sagging skin, none of those things that we want, and of course skin cancer. And sun damage during childhood is especially harmful. I'm always telling my kids that just one blistering sunburn nearly doubles the risk of developing melanoma later in life. Now, according to the Melanoma Foundation, more than 1 million Americans are living with it. And while the two most common forms of skin cancer, basal cell and squamous cell carcinoma, are highly curable if caught early, the treatment can be disfiguring. So you want to try to avoid all of those things.
Okay, so while we don't want to hide from the sun altogether, what can we do to avoid too much?
Okay, well, some sun exposure is important for the production of vitamin D, to boost your mood and mental well-being, and to regulate your body's internal clock, which can improve your sleep. So no one is telling you that you should stay indoors all the time. You just want to be careful about how much UV radiation actually hits your skin. So stay in the shade when the sun's rays are at their strongest between the hours of 10 a.m. and 2 p.m. You can wear protective clothing, including a wide-brimmed hat, and of course apply a broad-spectrum water-resistant sunscreen with an SPF of 30 or higher, reapplying it every 2 hours or sooner if you get wet.
And finally, tell us about the young scholar who's trying to cure skin cancer with a bar of soap.
I love this. So at just 13 years of age, Hemin Bekele came up with an idea to treat melanoma using a basic bar of soap. He was actually awarded with the 3M Young Scientist Challenge and was featured on the cover of Time magazine. His idea basically is to embed the soap with cancer-fighting drugs that, when lathered on the body, activate the body's immune system to fight cancer cells, making a more affordable and accessible solution for people all over the world who may not be able to pay for expensive cancer therapies. At the age of 16 now, he is well on his way. With the help of scientists, he actually has begun conducting laboratory tests to determine its safety and effectiveness, and he plans to test this seemingly simple yet innovative therapy on human beings in the future.
Wow, so impressive. Dr. Malika, thank you so much for joining us.
Thank you, Cindy.